Inside Edition's host, Deborah Norville, underwent a surgery for thyroid cancer. An issue first pointed out to her by a viewer when they noticed a lump on her throat as they watched her on TV. Joining us now to discuss is family physician and associate professor at Rowan University, Dr. Jen Caudle. Dr. Caudle, thank you so much for being with us.
Thank you.
So this viewer was able to actually spot that lump on Deborah's throat. Do thyroid issues always present themselves this way? And are there other symptoms that perhaps we should be looking out for?
So that's a great question. Thyroid issues do not always present that way where we see a lump, but I have to say, I know that Deborah is really grateful for that viewer. I am as well. And that also sort of points out the power of being very observant about our bodies and the bodies of others, because we can sometimes see these things. Now, as you mentioned, sometimes it's not always a lump that we see that identifies the thyroid. And by the way, I want to point out the thyroid is a butterfly, a little bit of a butterfly gland that sits at the base of the neck. That's kind of what it looks like. But other symptoms such as hoarseness or trouble swallowing, painful swallowing, or an enlarging neck, any of those or others could be signs that something's going on with your thyroid.
And Dr. Caudle, what do people commonly confuse thyroid cancer symptoms for?
Oh, that's a really interesting question. To be honest with you, not everybody with thyroid cancer will actually have symptoms. I'll be very honest. Some people don't have any symptoms at all, and they present, and all of a sudden we find a nodule or something else, and then it seems like it might be cancerous. So I want to stress that just because you don't have symptoms at all doesn't mean you shouldn't get checked out. But the thyroid gland does a lot of things. It deals with hormones in our body. So in terms of what else could be mimicking that, well, it could be a lot of stuff. This really speaks to the idea of getting your checkups, going to your doctor regularly, and really getting that once over at least once a year or more frequently so that you're getting all of these things looked at.
Right. And given how common this can be and how it can sneak up on you, since there can certainly be a lack of symptoms associated with it, should we include testing for thyroid cancer in our regular screenings?
Yeah, that's a good question. So right now there's no formal recommendation that I'm aware of that recommends a screening for thyroid cancer as a routine preventative screen. Some people may benefit from thyroid blood tests to see how well their thyroid is functioning, but that still depends on the person. Again, I think the best thing is to be seeing your doctor regularly so that they can not only feel your thyroid, but also ask you about any symptoms that you have, get your family history, your personal history, because remember, certain risk factors like radiation, et cetera, may increase your risk for thyroid cancer. That really should be what drives if we test and screen you for thyroid cancer.
Right, and we know Deborah Norville, of course, is a mainstay there on Inside Edition. Do we know how long the recovery period typically is for thyroid cancer surgery?
So you know what, many people do quite well, and oftentimes they recover from surgery quite well. Obviously it depends on how well the incision heals and if there are any complications and things like that. But, I know that we're all sending Deborah very well wishes and really praying for her speedy recovery. Absolutely.
Indeed. And Dr. Caudle, switching gears here a little bit, something we've been hearing so much about, measles. The number of measles cases in just the first 3 months of 2019 have already surpassed the number for all of the cases in 2018 in the United States. Doctor, why are we seeing this outbreak?
Yeah, it's really a tragedy, to be honest with you. And you're right. This is actually the second largest outbreak of measles that we've had since the year 2000, when measles was considered eradicated. The biggest reason that we think that we may be seeing increased measles cases has to do with unvaccinated, those who are unvaccinated, and travelers. Remember, there are many parts of the world that still have measles that's running rampant. And if somebody who's unvaccinated or doesn't have full immunity goes to a country and picks up measles, they can easily bring it back to the United States, and we may have and often have pockets of unvaccinated people here. It can spread like wildfire. So travel and those who are unvaccinated, that sort of combination is probably the biggest reason why we're seeing this increase in cases.
And how serious is measles, and what are we doing at this point to prevent it?
Yeah, I'm glad that you asked that, because I think a lot of times we forget just how serious measles is. Before we had a vaccine in 1963, millions of people got the measles every single year. Millions of people were hospitalized. We know that 1 to 2 out of every 1,000 children who gets the measles will die from it. Yes, the symptoms are typically mild: a rash, itchy, watery eyes, nasal congestion, high fever, etc., meaning self-limited. It may go away with supportive care. But for some people, it doesn't just go away. It may cause pneumonia. It may cause ear infections. It may cause even brain swelling. And like I said, 1 to 2 out of every 1,000 children will die. So, I mean, we really can't underestimate the importance of this. One of the best ways to protect ourselves is getting vaccinated for sure.
Right. Dr. Caudle, great information. Once again, thank you so much for being with us here on Cheddar News.
Thank you.